Is why do we need lasers, or why do we choose lasers to treat melasmas? And the reason for this is because different frequencies of energy have a high affinity for melanin. Now, what does that mean? If this was a molecule of melanin and I have the right frequency of energy, the melanin would just absorb the energy, it would just suck it up, and I wouldn't have to use high power to force the energy into the melanin. So what I'm going to do now is draw out the whole process for you, the whole equation, so to speak. So here we have a graph, and this bottom line is the baseline color of your particular skin type. And over here we have melanin. So this reflects the amount of melanin in your skin. So this is your baseline, your basic color of your skin, the color that you want it to be. And over here is the measure of where your melasma is, the amount of melanin in your melasma. So we will treat your melasma right here with a particular frequency of energy that has a very high affinity to the melanin. And because of the fact that it has a very high affinity, we can use really low power. Again, we don't have to force energy in. The melanin is just going to absorb it. Now, why is that important? For two reasons, two critical reasons. Number one, because we're using low power of energy, we don't risk stimulating the melanocytes. Remember, the energy that comes out of a laser is light energy, just like the light that comes from the sun. And what do we know about melanocytes? They are stimulated by light energy. So if I'm using a laser with high power, yes, the energy is going to be absorbed by the melanin, but it's also going to penetrate deeper, down to where the melanocytes are, and you risk stimulating them and actually making your melasma worse. Now, some of you have had treatments like that, where a wrong kind of laser was used or too much energy was used, and it did make your melasma worse, so you know exactly what I'm talking about. So, number one, we use low power of a high affinity kind of wavelength or frequency so that we do not stimulate the melanocytes and we don't risk making it worse. The second reason that we're going to use low power is because of what does happen to the melanin in your skin. So here is melanin in your stratus corneum, in that dead layer of the skin, and melanin in your epidermis. The energy is going to go into the melanin. It's not going to be high enough to poof, vaporize it, but just enough energy to essentially cook the melanin a little bit. It's going to change its molecular structure. So here's a molecule of melanin, the energy goes in, and boom, we've changed the molecular structure. So then what happens? You walked into the clinic with a whole bunch of melanin in your skin, and you're going to walk out of the clinic with the same melanin that you came in with, except a whole bunch of it is now altered. Its molecular structure has been changed. And what happens now? You leave the clinic, and over the next 3 to 4 weeks, the immune system gets involved. The immune cells come around and they look at this altered melanin and they say, hey, this looks like melanin, but it doesn't smell like melanin. This is a foreign particle. It's altered. It doesn't belong here. And what does the immune system do with particles that don't belong? Little immune cells come out like little Pac-Men and they chew it up. They dissolve it away. And over the next 3 to 4 weeks, you'll see that your melasma fades away, fades away, fades away. And then it'll stabilize because, again, we didn't get all the melanin. Melanin is in layers. So we treat again, and over the next 3 to 4 weeks, fades away, fades away, fades away, stabilizes, treat again, and then over the next 3 to 4 weeks, fades away, fades away, fades away. Now, you'll notice that there's a little bump. With each time we treat your melasma, there's a little bump in this curve here, which represents the fact that when we change the molecular structure of the melanin, it changes color a little bit. It might get a little darker, it might get a little bit of an ashen color. The melasma is fading out. In 3 to 5 treatments, it should be all the way back to your baseline color, and that's fabulous. But what about the melanocytes? The miracle of all this is that not only is your immune system getting rid of the extra melanin in your skin, but for some reason that we don't even understand, somehow the immune system's involvement is resetting the thermostat on those melanocytes from 80 back to 72, so that the color, the extra melanin, the melasma does not return. The innate wisdom of your immune system can do it better. Now, I've talked about having the correct laser that has a frequency of energy that has a high affinity for melanin. And it's not the same for every person. It's not the same for every melasma. People's melanin does alter, does change a little bit from person to person. Also, the depth of the melanin in a person's skin may vary. That's why we have so many lasers here. There are 5 known frequencies that have an affinity for melanin, starting with 532 nanometers and going all the way up to 1064 nanometers. Now, depending on the person, one of these different frequencies may be better, may have a higher affinity for their melanin than a different frequency. So that's one thing that we have to look for. The other thing is different lasers pulse the energy in different amounts of time. There are long pulse lasers that pulse in the 1,000th of a second. Let me stop here for a minute. Some of you are thinking a long pulse is measured in 1,000th of a second. 1,000th of a second is an impossibly short period of time. But in the world of physics, an 1,000th of a second is actually a long period of time. So yes, there are lasers in this room that pulse the energy in about 1,000th of a second or 2,000ths of a second, short pulses like that. But there are also lasers that are called Q-switch lasers that pulse the energy in 1,000,000th of a second, and they interact differently with melanin. And there are also lasers called pico lasers that pulse the energy in the 1,000,000,000th of a second. Each one of these interacts differently with melanin. So we have 5 different frequencies of energy and 3 different pulse durations or pulse lengths, which means we have 15 different types of lasers that might be the right frequency for your specific melasma. And believe it or not, for some people, it's a combination of lasers that we have to do to get the skin to respond its best in removing your own melasma. How do we know which is which? Some patients, we actually have to do some test spots. We will test different frequencies and different combinations of frequencies, give your skin a few days to respond, let your immune system get involved, and we see and we assess what your skin is doing before we actually write a protocol. This is a critically important part of treating anyone, actually for any kind of medical treatment, that you customize the protocol for that particular patient's physiology. So we take the time to do that on many of our patients in order to get the very best response and to clear your melasma the most efficiently and effectively and also cost effectively.